This is KROWN Hospital. My name is Dr. KAYODE Akindlade, Medical Director. This hospital was established about 31 years ago as a purposely built hospital with various departments that makes us have a multi-specialty kind of practice. Multi-specialty practice. And one of the main reasons for establishing this hospital is for us to be able to contribute our quota to the development of quality healthcare in Nigeria. The hospital was commissioned on the 15th of December 1991 by the outgoing executive governor of Lagos State at that time, Brigadier General Raju Rasaki, at a ceremony in these premises. And ever since, we have grown over the years to a well set up medical practice that can boast of having a hand in major specialties of medicine like surgery, internal medicine, pediatrics, obstetrics and gynecology, laparoscopic procedures, or what they call minimal access procedures, so that we don't have to open the abdomen with a wide incision to do some surgical operations. Orthopedics, neurosurgery, urology, ophthalmology, ear, nose and throat, cosmetic procedures, maxillofacial surgical procedures. And in the area of internal medicine, we also have renal dialysis units for people with kidney challenges. And we've been able to develop a neonatal section for premature babies, as when we talk of pediatrics. And we have facilities for neonatal care, incubators, phototherapy machine, and CPAP machine for critically ill patients or critically ill babies with respiratory problems. And we've been able to treat a lot of people and bring them back to life. We have an intensive care unit whereby for critically ill patients there are specialized rooms with specialized equipment to take care of them. And we have been, by the grace of God, successful in bringing back to life a lot of patients that hitherto will have died if those facilities are not in place. We cannot do this alone. We are in partnership with various consultants, both here and abroad, who come as needed to help in ensuring that we give standardized care to our patients. And not only that, we have been able to tie up with some health institutions abroad, such that if there are cases that we cannot handle here locally, we take them abroad. Sometimes we follow our patients abroad. Either the doctor follows the patient or our nurses will follow the patient there. With a lot of our patients, we take them there, we bring them back alive. This cannot be possible without the dedication of members of staff in this hospital. Doctors, nurses, and other auxiliary staff in the hospital. Because the success of this hospital is in the cooperation and collaboration of members of staff. But here we work as a family, and that is the selling point that we have here. The other thing is that we are visionary. We think ahead, and we want to be remembered as one of the hospitals that hold care as a prime motive for the setup. Care with empathy, care with sympathy, care with the fact that we feel the pains of our patients. And when we have all these qualities and get this imbibed into our members of staff, with prayers and the power of God, we are able to achieve so much. We also remember at all times that we care, only God heals, and that is our motto in this hospital. And we hope that we continue to grow such that others, young doctors, will have opportunities to use our facilities for training. That is our hope, eventual hope in this hospital. Because we cannot have these facilities to ourselves alone. It is there for even our colleagues to come and make use of them, for younger colleagues to also train and gain expertise and experience and exposure to a lot of the equipment that we have in this hospital. The rating of this hospital is left for the public. I cannot be my own judge. All I know is that we are putting our best into it, we are putting our life into it, and we are passionate about our practice in this hospital. Do our best as much as practicable, and we leave every other thing to God and the members of the public to judge us. We cannot judge ourselves. We will operate a mini local government in this hospital. We provide our source of water, we provide our power. We have 3 generating plants, and we must provide light 24/7 in this hospital. This is not a home. In my house, I mean, it's not to have electricity, but it's not the case in an hospital. And these are the problems of challenges that we face in the running of this hospital. And this has made the running costs really to be very, very astronomical for us. We hope that we expect government to come to the aid of private practitioners, because we are looking after the same set of people that government is looking after. Only that we are doing this for a little profit. And I would say that healthcare is not free anywhere in the world. Is somebody somewhere is paying for that healthcare. Either the government is paying for it, where they say health is free, or otherwise. I'm aware that out-of-pocket expenditure is the order of the day in this country. So that means my hope that the National Health Insurance Scheme will expand so much that it will cover every Nigerian, so that and such that we'll be able to offer healthcare to a lot more people than we currently do. And that will make us busy as well. And somebody will have to pay for that. And that is government through the National Health Insurance Scheme.